welcome. What do newborns look like and do? Despite what you may have seen in movies, birth is no picnic for baby or mother, so don't expect to see a perfectly formed little being the moment they appear. Initially, babies are born puffy-faced and often with cone-shaped heads. If the birth involves a ventouse, the top of your baby's head may bulge a little and have a circular red mark. And if forceps were required, there may be temporary marks on your baby's head. Term baby, meaning a baby who isn't born prematurely, will generally weigh anywhere between 2 and 4 kilograms. And if you've had twins, it's normal for one to be bigger than the other. It's very normal for babies of all ethnicities to have a greyish-blue colour at birth, but after a few breaths, their colour should begin to look healthier. For a while, the skin can look blotchy, red, flaky, peely, and lighter or darker than you'd expect. A lot of babies are also born covered in a white, creamy substance known as vernix. There's no need to wipe this off, as it's good for your baby's skin. You may also notice birthmarks, which are very common, entirely harmless and usually temporary. Stork marks, which are marks near the nape of the neck or on the eyelids, are caused by dilated blood vessels and usually disappear within the first year. Within 4 weeks of birth, strawberry birthmarks may appear. These are raised, red and lumpy marks that generally fade at 2 years old. Port wine stain birthmarks are flat red marks that appear in about 2 in 1,000 babies. They won't generally fade away. Some babies have Mongolian blue spots which can look like bruises over the buttocks and back. These fade and generally disappear by the age of 4. If you have any concerns in regards to birthmarks, speak to your doctor or midwife. Something that may occur in both baby boys and girls, which may surprise you, is that they may have swollen genitals and breasts. There may even be a little bit of milk discharging from their breasts. And a girl baby might even have some blood coming from their vagina. This is normal, simply caused by a mother's hormones circulating through their baby, and should disappear after a day or 2. So now we have a pretty good idea of what your little one will look like for those very first few days. But what can you actually expect them to be doing during this time? During their very first 24 hours, your baby will spend most of their time sleeping. And though you'll of course be excited at their eventually having arrived, you'll be tired too and thankful for the quiet. They will wake up occasionally and want to feel you near them, touching, cuddling, holding and feeding them. Despite the fact that they look to be in their own little world, they can already clearly see your face, providing it's within 25 centimetres of their own. Their heart rate may increase when they make eye contact with you, and they'll recognise both your voice and smell. Your baby will also be born with a set of inbuilt reflexes. They'll grasp anything put into their fists. They'll suck and swallow milk from your breast or a bottle. They'll take a step if you hold them up with their toes touching a surface. If they hear a loud noise, they may throw their arms up suddenly. This is known as the Moro reflex, and they'll root for the nipple if you stroke their cheek with your finger or breast. But is there anything you need to keep an eye out for? If the whites of your baby's eyes or their skin is turning a yellow colour, they are jaundiced. Jaundice can be caused by a number of things, including bruising at birth, and should you notice it, speak to a doctor or midwife. The general treatment is frequent feeding. However, should you notice signs of jaundice in the first 48 hours, this can be quite serious, so get in touch with a medical professional as soon as possible. Finally, the first few times your baby poos, they'll be sticky, tar-like and greenish-black in colour. This is caused by a substance known as meconium and is an accumulation of the waste products they collected in the womb. Most babies will excrete this in the first 24 hours, but some don't. If your baby doesn't do a black poo after 24 hours, their belly is swollen and tight or they're vomiting, speak to a midwife or doctor immediately. Meconium is very hard to wipe off, so it can be helpful to put some nappy cream on your baby before their first poo to make it easier to wipe away. Before you take your baby home or before your midwife leaves, a medical professional will check your baby's vision and hearing, heart and lungs, spine, hips, internal organs and sucking reflex. So as long as all goes well, all you need to do in the first 48 hours of your beautiful new baby's life is to feed them. Change the old nappy, and cuddle them endlessly. So, to recap, babies can look a little unusual at first, but that's normal. Their head might be a little cone-shaped, and they may have a birthmark or two that will likely fade. But after a while, they'll start to look more normal. Look out for signs of jaundice and speak to a doctor if they haven't done a greenish back poo.